Hi, everybody. So I would like to start this webinar by introducing our moderator, Barry, here for you. Barry, you can start.
Hi, everybody. Good day. Wherever you are, it could be good morning, good evening, good afternoon. We are welcoming you and thanking you for joining us live to watch our launch of our online course for educators on digital health. I'd like to warmly welcome our seminars and our co-moderator today, whom I will shortly introduce later. Next. My name is Barry Blight. I'm a professor in social behavioral and administrative pharmacy at the College of Pharmacy at Nova Southeastern University in Fort Lauderdale. I'm also a member of the Module 3 section of this online training and look forward to you hearing more about that later. Next. These are some of the announcements that we have that the recording, you can see where the recording is going to be available because it's all being recorded. Please ask questions in the question box. I will be monitoring that so that when we get to the panelists, we can have your questions answered. And please go to webinars at FIP.org to put in your feedback so we can see that. And then I'll talk several times about becoming a member of FIP if you're not. It's a very important organization to be part of. Next. Today, I'm going to be introducing things. As you can see, this is what I'm doing now. And then we're going to start with a message from the CEO of FIP, from the president of the academic pharmacy section, and also from the chair of the FIP Technology Forum. Then we'll go into a brief summary of the FIP Digital Health Report and an overview of the Train the Trainer modules, and looking at how to look at how the program and partners are working together on this, and then very importantly, how to register this course. From all over the world, we can register for this, and then we'll have Q&A, and then we'll close. Next. FIP, the International Federation of Pharmacy, or Fédération Internationale Pharmaceutique, is a global federation of national associations representing the 4 million pharmacists from around the world. It has a vision of world where everybody benefits from access to safe, effective, and quality and affordable medications and pharmaceutical care. They've been doing this since 1912. Now, I haven't been going to the meetings quite that long, but I've been going to the meetings since the 70s. And this is a marvelous worldwide organization for everybody to engage and find wonderful pharmacists from all over the world. Next. ONEFIP. Under the maximum of ONEFIP, we started to break down these silos and trying to unify all the different sections and have all the internal structures within the organization working together. And so we're trying to get all pharmacists from the very different health systems and to be able to take on new roles to provide new services and put it all under the 3 main domains of science, education, and practice. These 3 domains working together are crucial to our profession. Practice cannot exist without science or education, and only this interdependency and collaboration of these 3 domains can ensure universal health coverage for our patients. And this is why we do what we do. Next slide. I'd like to introduce the FIP academic pharmacy section, which is one of the section I'm certainly part of. This is where the project of digital health and pharmacy education started. And it was founded in 1972, as you can see. And It was placed in the Board of Pharmaceutical Practice and FIP Education. Our mission is to serve as an international source for networking, collaboration, and inspiration for educators to transform pharmacy education for the purposes of advancing practice in science. And you can see the website below where you can locate us, acps@fip.org. Next slide, please. We have international memberships. It's a global network. We have members from all over the world. There's an FIP academic institutional membership who's one of our collaborators today in this project. And it's the only global network for our academic pharmacy leaders. With schools of pharmacy for all the way from New Zealand and Arizona, all the way across Asia, Africa, and Europe, into South America and North America. It covers everything. And we have a lot of great members and great schools. AIM members benefit from the expertise of a dynamic group of academic leaders that are working collaboratively to improve pharmacy education around the world. Next slide, please. It is with my great pleasure, and I couldn't bring in the marching band like I promised, but I want to introduce the program who's going to take, my co-moderator who's going to take over from here. It's Dr. Naoko Arakawa, and she's an assistant professor in international pharmacy at the School of Pharmacy at the University of Nottingham in the UK. She's the secretary of the FIP Academic Pharmacy Section and the global lead for the competency development of the FIP Workshop Development Hub. I can say that. She is the co-lead of this program and will moderate the next portion of this meeting and this event. Now, Dr. Arakawa, it's yours.
Thank you, Barry. Thank you, Barry, for your kind introduction. Hi, everybody. Good morning, good afternoon, good evening, whatever you are at the moment. So now I'd like to introduce you the FIP Online Train the Trainer program, Digital Health in Pharmacy Education. So first of all, I'd like to introduce our FIP CEO, Dr. Catherine Duggan, to hear her welcoming words.
Dear colleagues and friends, thank you so much for inviting me here today to this very important event of the year. Thank you to our two moderators today, Barry and Naoko, to the FIP team, Dahlia, Genuine, and
sorry that it stopped. So
dear colleagues and friends, thank you so much for inviting me here today to this very important event of the year. Thank you to our two moderators today, Barry and Naoko, to the FIP team, Dahlia, Genuine, and Chuchen, and to all the officers and volunteers who have worked so hard to take this project forward. As ever, we are truly grateful. To those of you who don't know me, I am Catherine Duggan. I'm the Chief Executive Officer of FIP. I've been in post since June 2018, during which time, colleagues, we have seen such seismic changes in all of our personal and professional lives, across all sectors of our profession, and across all nations of the globe. What times we live in. And it's the very challenges we have faced that makes digital enablement and the place of technology so important to us today. So we all know that digital health technologies save lives, improve health and well-being, increase access to care, and lead to effective health systems and healthier populations. With the increased complexity of health conditions and aging populations, digital health can be the key to many unmet needs in health and related services. Indeed, healthcare professionals, including pharmacists, are dependent on their uptake and appropriately used digital health to improve the health and well-being of patients and consumers. However, in order for us to be able to deliver digital health, knowledge and skills in digital health must be integrated into our education and training at all levels, both from the initial education that our students receive, but also into continuing professional development and advancement so that all of us can benefit from wider understanding. Therefore, we would argue that education is at the centre in accelerating the uptake of digital health to provide optimal person-centred care and digitally enabled pharmaceutical care. In Jan 2021, exactly this time last year, FIP published a significant report on digital health in pharmacy education. It was entitled Developing a Digitally Enabled Pharmaceutical Workforce. The report presented findings based on a survey conducted by FIP to investigate the preparedness of the pharmaceutical workforce in digital health. The findings revealed education and training gaps due to a lack of familiarity and knowledge in digital health perceived by educators and practitioners. The report proposed a series of recommendations, one of which was to equip change makers, the trainers, with the essential knowledge and skills, who will in turn support integrating digital health in pharmacy education and expanding digital capacity in the field of digital health. Developing and consolidating knowledge and skills in our workforce will assist current and future pharmacy practitioners in delivering digital health in practice, which of course, colleagues, eventually contributes to improving the health of our nations. The purpose of the project that was set up thereafter was to develop and deliver a Train the Train programme in digital health. This was for academic pharmaceutical section members and FIP members, a true example of leadership in practice. We are pleased to share that since February last year, a group of FIP officers and members responded to this gap and embarked on this Train the Trainer online course that all our members at FIP can avail of to become the change makers in their field and their contexts. This project is a ONEFIP project. The ideology behind a ONEFIP project is that they are projects that deliver on FIP strategy, involving multiple constituencies, pulling us together under a shared vision. Today, I'm so proud to share that the academic pharmacy section led the development of this programme in collaboration with our academic institutional members, the Technology Forum of FIP, and our Young Pharmacists group, as a proof of concept, supported by Provision and Partnerships. Other ONEFIP projects include our vaccination programmes, our NCD programme, and indeed safety this year. It's very important for us to unite around shared endeavours and to pull together the expertise across all our officers and volunteers, because within our sections and our boards, we have all we need, really, colleagues. We have you, and we thank you. Now, more widely, if you are a member of FIP, tuning in either live to the event or afterwards, and you are interested in becoming a change maker by embracing new skills and knowledge and leveraging a vast range of resources in digital health to empower and educate students or colleagues, after all, we're all students in this endeavour, I really encourage you to register your interest to be enrolled in this course. We are also interested in the evidence and impact, and our staff and colleagues will be interested in how you will have benefited from the course and how it may have impacted your practice. I made a couple of thanks at the beginning, but I just want to make some special thanks behind the powerhouses of this programme. Special thanks again to Naoko, to Alka, both of you, equally and actually specially for driving this work. I've already mentioned the FIP staff and provision and partnership programme, but I also want to mention our wonderful colleagues from YPG, including the two our YPG interns I acknowledged at the start, Chu Chen and Genuine. We really are grateful to all of the people who work with us in all different types of capacity. After all, colleagues, when we are living through a pandemic and the only way we can engage with each other is digitally, it's important that we pay a special thank you. I'm looking forward to hearing about the people who are going to embark upon this course and your feedback on the event itself. A huge congratulations for today's event. Thank you so much for your participation. I look forward to the results of it. Take care, be safe, and we are in touch. Bye for now.
So, thank you very much, Catherine, for your welcoming words for the program. So now I would like to introduce the president of the FIP Academic Pharmacy section, Professor Clint Farley, to hear her welcoming words.
Greetings, colleagues. Hope this recording finds you well and safe. Recently, FIP published a significant report the FIP Digital Health in Pharmacy Education, Developing a Digitally Enabled Pharmaceutical Workforce in January 2021. The report illustrates needs of developing changemakers who support integrating digital health in pharmacy education and of expanding the academic capacity in the field of digital health. This report, we believe, will enable and assist future pharmacy practitioners who deliver digital health in practice, which will eventually contribute to improving health of our population. I'm excited to let you know that Dr. Naoko Arakawa, the Secretary to the Academic Section, and Professor Ikea Mantel-Tuis, an EXCO member of the Academic Section, are co-leading a project to develop an online Train the Trainer program on digital health in pharmacy education. Specifically, the team will develop and deliver an online masterclass program in digital health education for the academic section and for academic institutional members so that they can increase academic capacity in digital health education and develop change makers to integrate digital health in pharmacy education. As president, I am excited that the academic section is leading in this space, and we want you to be a part of this work in your respective countries and regions. Stay tuned for more on this, and we look forward to serving you. Welcome to this program. Thank you, and God bless you.
Thank you, Twin, for your very heartwarming message to the audience and the program developers as well. So now I would like to introduce Ms. Jacqueline Strug, Chair of the FIP Technology Forum, to hear her welcoming words by introducing the FIP Development Goal 20 Digital Health, which is the program's central focus.
Dear colleagues, the slides I'm going to present to you are an introduction on FIP Train the Trainer online course on digital health in pharmacy education. It concerns FIP development goal number 20 on digital health. I am Jacqueline Strug. I am the chair of the FIP Technology Forum, and I am a hospital pharmacist in France. Further on digital health development goal, I think we should set it in the broader context of the ONEFIP approach. According to this approach, we cannot have pharmaceutical care, which is our daily practice, without a competent pharmaceutical workforce. And competent pharmaceutical workforce means not only workforce, but also education. And we cannot have pharmaceutical care without a strong scientific foundation. And here are the three pillars where FIP stands on, which are practice, science, and workforce and education. To reach this, FIP over the years has developed specific goals which encompass all our daily practice in all domains. So we began to develop those goals in year 2016, and in year 2021 we had 21 goals, and you see those development goals all here. I guess you are familiar with this, and digital health is on development goal number 20. So each of these goals have the three elements that we presented a bit earlier, that is practice, science, and workforce and education. And this is the case with the development goal number 20, and we're going to see this in details. So the workforce element of digital health development goal concerns enablers of digital transformation within the pharmacy workforce and effective processes to facilitate the development of a digitally literate pharmaceutical workforce to increase a digital literacy. The practice element concerns systems and structures in place to develop and deliver quality digital health and pharmaceutical care services through the digital literacy and utilization of technology and digital enablers, configuration of responsive digital services to widen access and equity. And access and equity are very important terms here, as we will see a bit later. And the science element is application of digital technology in healthcare delivery and development of innovative medical products. So let us see that in detail.
Okay, thank you, Jacqueline. So now I'd like to take this opportunity to say thank you to Jacqueline for her service at FIP, as she now resigned from all her FIP officer's role. So she was a chair of the Pharmaceutical Technology Forum and supported the development of this program, while she hugely contributed to the FIP statement on digital health. She served her numerous positions in the FIP and supporting the growth of the FIP to this date. She also held the various positions across Europe, as you can see in the slide. We appreciate her service at FIP and wish her the best for her next endeavor. So now I'd like to welcome Ms. Nguyen Usman, FIP Lead for Education Policy and Implementation, to revisit to the FIP Digital Health in Pharmacy Education report published last year. Nguyen, floor is yours now.
Thank you very much, Naoko. Hello, colleagues. Welcome to the launch of the Digital Health for Educators Train the Trainer course. Next slide, please. Exactly 1 year ago, we launched the FIP Digital Health in Pharmacy Education report in our mission to develop a digitally enabled pharmaceutical workforce. This first ever report in this field, presenting findings from a survey which was completed by more than 1,000 academics, practitioners, and students from 91 countries to describe readiness, adaptability, and responsiveness of pharmacy education and knowledge and skill needs of pharmaceutical workforce on digital health. You may download the report from the link that I'll be providing from the chat in a while. Also, this is an opportunity for me to recognize Mrs. Jacqueline Suru, in which she supported the launch of this report during her role as a chair of the FIP Technology Forum. And of course, I'd like to thank to the volunteers and also the respondents of the survey who have contributed to the launch of this report. Next slide, please. Our report has been used as a global evidence base in integrating digital health into pharmacy education. And our report again supported the pharmaceutical workforce to obtain the necessary digital health knowledge and skills so far. Based on the findings, we identified 4 key way forward areas, which you're seeing on the screen right now. And we actually made progress towards all of them within the first year after the launch of this report. Today, we are launching the FIP Train the Trainer online course on digital health for educators. And this is our key progress. This course is our key progress towards implementing FIP development goal number 20, digital health, in order to develop the digitally enabled pharmaceutical workforce. This course will digitally enable educators and provide them with curriculum, training resources on digital health. As the TTT project team, we are very excited to be launching this course, and I sincerely thank our FIP volunteers and speakers in this course for providing their expertise in digital health education. Thank you very much. Over to you, Naoko.
Thank you, Nihan. So now I'd like to welcome Professor Akie Mantotwasi, Professor of Pharmacy and Global Health and Director of School of Pharmacy, Utrecht University. And she is an ex-member of the FIP Academic Pharmacy section, and proudly she is a co-lead of the program with me and the lead of the FIP Digital Health in Pharmacy Education report. Akie will be introducing needs for developing the Train the Trainer program on digital health in pharmacy education. Akie, floor is yours.
Thank you, Nilhan. Next slide, please. I think it's very timely that 1 year after the report, exactly 1 year after the launch of the report, we are now here with this Train the Trainer course. I just wanted to show you a few slides from the report, and one of the questions we asked academics in that survey is, does your school offer a course on digital health? And actually about 40% said, yes, we do, either as standalone or integrated as an already existing course. But over half of the people said, no, we do not yet. And at the same time, people indicated that they were interested in doing so. But when we asked them what the challenges are that they faced, either when they implemented it or the challenges that they fear they face, and maybe also the reasons why they had not yet been providing digital health education, you can see that at top of it is lack of experts to facilitate learning experience. Because many of us working in academia, in pharmacy schools, are not expert in digital health ourselves. And I sincerely hope that this Train the Trainer program will then also add to fill that gap. And apart from that, we have to be realistic. Also, sometimes lack of resources, lack of guidance, lack of time, all play a role. But with this course, helping you to be trained yourself, and also, again, mention maybe the technology forum, where we aim to also provide you with information as a platform for materials. We also hope to fill a gap. Next slide, please. And another, I think, important picture from this report was taken from a publication by our colleague Timothy Gangst, is that people might be in different phases. People might be within their school still in the exploratory phase, considering introducing elements or maybe a small course related to digital health. Some might be in the initiation phase, where they may have an elective track, where they really start to build into the curriculum. And some might already be in the standardization phase, where it really becomes an integrated part of the full curriculum. But wherever you are, we hope that you will benefit from this course, and we will also pay attention to the different phases that people might be in. So I hope you will enjoy it, and now hand over back to Naoko. Sorry.
Thank you, Akie. So now I'd like to introduce the aim of the program. So this program targets to the academics and the educators in pharmacy who are also the FIP members and as a main audience. But we also welcome pharmacists and pharmaceutical scientists from other sectors to observe the course if you're interested. 3 objectives were set for this program. And at the end of this program, learners will expand their teaching capacity in the field of digital health and become a change maker in supporting the integration of digital health in pharmacy education, then assist future pharmacy practitioners delivering the digital health in practice. So in order to fulfill the objectives in the previous slide, the program covers 3 modules. And additionally, we recommend to take AIM leadership program to be an additional feature for those who would like to pursue becoming a change maker in the bigger picture. So the 3 modules in this slide from the first 1 to 3 in the program are the first module on the introductory knowledge of digital health, then second module of integrated processing in teaching, then lastly, third module of the digital health curriculum development. You will have the assessment or assignment at the end of each module. And then if you complete all modules with successful assessment and assignment, you will receive a certificate from the FIP for the completion of this program. Regarding the AIM leadership program, please refer to the program information on the FIP website. So now I would like to move to the introduction of each module. Here, I'd like to welcome Mr. Jaime Acosta-Gomez, Secretary of FIP Community Pharmacy Section, to introduce the Module 1. Jaime, floor is yours now.
Thank you, Naoko, very much. Thank you very much for having me. It's a pleasure and an honor to be here with you today. I hope there's not too much noise in the background because I'm also a practicing community pharmacist and I'm in a consultation room presenting to you the contents of the module number 1 of this course. In the next slide, we can see the learning outcomes that we will try to provide you with after completing the first module. We would like to describe some common digital health tools and services and their use in pharmacy and pharmaceutical sciences. This is the technical part of the course. We will try to provide you with the technicalities and practicalities to let you know, be aware of what digital health tools are being used from different aspects of pharmacy practice. We will try to let you identify key aspects or challenges and the impact of digital health in healthcare services, systems, and professionals, to let you have the vision of how transforming digital health can be in terms of pharmacy practice, and how digital health tools can let practitioners provide better, faster, more personalized, person-centered, with better outcomes service. And last but not least, the importance of using evidence-based digital health tools. Digital health is evolving very fast, and of course, not everything is solid evidence-based tools. And as it happens with medicine, pharmacists cannot use any product when servicing our patients. So the same with digital health. We need to provide evidence-based tools also in digital health. In the next slide, I would like to show you the team that has left me with the honor to be here with you today. You have some QR codes on the right of your screen if you're interested in accessing our LinkedIn profiles. Whitley G from the USA, she's an expert, especially in artificial intelligence. Michael Katz, he's a professor at the University of Arizona College of Pharmacy in the US. Natasha Jovanovic-Leskovic from Serbia, who is holding and has held in the past different positions regarding to innovation in pharmacy practice. Abasibiangake Sunday from Nigeria, who is the Pharmacy Operations Officer at Wella Health Technologies, and myself, in this case, last and least. In the next slide, I will take you through the contents. I will not go, in the interest of time, in very much detail. The first part, we try to provide you with the vision of what digital health is bringing to pharmacy practice and better care for patients and better service for healthcare systems. How can technology transform pharmacy and healthcare? We will include, we have included a glossary, some important digital health trends, and some miscellaneous resources to let you be aware of this potential. In the next slide, we get sometimes a deep look into the technological part of digital health. cloud computing, artificial intelligence, blockchain, Internet of Things, APIs, and so on, but from a technical point of view. And in the next part, we try to provide you in the next slide with the how these tools are being used in pharmacy practice. Electronic health records, e-prescribing and e-dispensing, online pharmacies, big data, telepharmacy, mobile health. Of course, we are now much more used to all of this after this very sad pandemic, which has been a super fast catalyzer to the application, to the use of these tools. We are now servicing distantly patients more than ever. And in the next slide, we offer you some voluntary readings in case you are interested in knowing more, which are not mandated to be read by you, to be able to pass the multiple choice questionnaire that we have for you in the last part of module 1. So I think this is all from me. If we can go to the next slide, I will hand it over back to Naoko. Thank you very much for having me.
Thank you, Jaime. So now I would like to welcome back Ms. Nilhan Uzman, FIP Lead for Education Policy and Implementation, to introduce the Module 2. Nilhan, floor is yours.
Thank you, Naoko. Hello, colleagues again. I'll be happy to introduce you the Module 2. Next slide, please. In Module 2, we'll be covering integrated process in teaching. Building on the foundations of digital health you will gain through Module 1, as my colleague Jaime has explained. In this module, you will identify opportunities to integrate digital health within your curricula. You'll be analyzing how to integrate digital health into your pharmacy curricula. And again, finally, you'll be analyzing how to identify competencies to integrate into education and prepare graduates for digital health at the end of this module. I had the opportunity to develop this module together with Professor Okyamantel and Dr. Naoko Arakawa, who are the co-chairs of this entire course. So we were delighted to work on this module for you on integrated process in teaching. Next slide, please. To give you an overview, brief overview of what's expecting you in Module 2, I'll be explaining our structure. First of all, Naoko will be providing an introduction to Module 2. So she will again explain in detail what's expecting you and how you will be completing this course. We'll be offering you pre-recorded lectures from various speakers in this course, and you will also have an assignment. One of the first lectures is to give you a framework on digital health for health education program adoption. Timothy Youngest, whom we used, whose important research and article on digital health education we covered in our digital health report, is also covered by himself in detail. So he'll be explaining different phases and different ways of integrating digital health into the curriculum, depending on which status you are in terms of your curricula and digital health. Then we'll be providing you country case studies from different phases. So we have 3 phases: the exploratory phase, where we have colleagues from Malaysia and Greece who explains initial steps of integrating digital health into your curricula. And in phase 2, we have more initiated, more progressed courses and modules. And again, our very own co-chair, Okyamantel, will give the case from Netherlands, and we also have a case from United Arab Emirates. In phase 3, standardization, so further progress digital health courses, further integrated courses into the curricula will be provided through the case studies from Canada and United States. Again, it's an opportunity for me to thank our speakers in this lecture for the case studies and also for the introduction by Timothy Youngest. These lectures, these case studies will be followed by a presentation, a lecture, again by our co-chair Naoko Arakawa, on competency-based education. So in this lecture, you'll explore digital health-related competencies in pharmacy education, again, to support you to integrate digital health into your curricula. And then finally, we have a case study assignment for you. We prepared you a template where you will provide us a reflective essay considering your own country setting. So if you are to develop your own digital health curricula, how would you do it, and how would you, what kind of reflections you would have in order to support you for such activity. And we will invite you to provide peer review feedback to the other learners case studies. You will be also receiving peer review feedback through other learners as well on your case studies. And regularly, Module 2 leads, Naoko and Akye, will be also providing further feedback on selected case studies on this course. And then finally, at the end of this case study assignment, you will be completing Module 2. On behalf of Module 2 team, we hope all the course participants will benefit from this module, and we look forward to receiving your case study assignments to learn more about your country's settings in digital health education. Thank you very much. Back to you, Naoko.
Thank you, Nilhan. So now, lastly, I would like to welcome Professor Lilian Aspati, Professor and Head of Department of Pharmacy, University of Malta, to introduce you the Module 3. Lilian, the floor is yours now.
Thank you, Naoko, and it's a pleasure to be representing my collaborators on this Module 3 development at the launch of this Train the Trainer program. And I would like to move on to the next slide, where we it's a privilege for me to introduce to you the people at the development end of this module. We were working together, Barry Blight, Professor Barry Blight from the United States, who you've met earlier as the moderator of this whole launch, together with Mansi Doshi, clinical pharmacist and faculty member from India. And together we were working on this Module 3, which has the focus of supporting the development now of the curriculum that includes the digital health aspect. So we're building up on Module 3, on Module 2, and the learning outcomes from this module are specifically to propose action plans and teaching models so as to integrate, so as to include aspects of digital health in a curricula for pharmacy education, as well as to explore experiential opportunities with digital health that could be offered at different stages of pharmacy studies. In the next slide, we can have an overview of the content of this Module 3. So the content of the Module 3 looks at 3 stages, whereby in the first phase, we have a focus towards experiences and spotlighting examples of how to empower staff and innovate teaching experiences that draw on supporting digital health education. And we have 2 pre-recorded lectures from Professor Ian Larson from Monash University, who shares examples of using the digital health aspect and providing teaching in the aspect of direct patient experiences, and the contribution by Professor Janos Jankuzovic from the Medical University of Lodz, and also the Quality Committee Chair for the WHO Academy, who shares his reflections on aspects of digital health, the challenges, and how to approach these challenges to integrate digital health in the curriculum, also from an aspect of interprofessional education. And then we can see that in the second part of the content for module 3, we have a pre-recorded lecture session by Professor Blight, sharing and working through strategic and action planning to integrate the digital health aspect in study units in the curriculum. And the final part was managed by Mansi Doshi, and she presents the experiential opportunities of using digital health in real-time experiential sessions. To support these pre-recorded sessions, we have a number of resources that you could actually visit and experience, which you could learn and integrate in your own experience of digital health teaching. And finally, to wrap up this experience, we have 2 exercises, one which is a peer review exercise, now moving on to having feedback from your own setup. So the peer review exercise is meant to discuss your learning experience in this curriculum with your colleagues from your institution, and to provide a plan of how you are going to overcome challenges and also take up opportunities to integrate digital health in the curriculum. So I hope that you will enjoy this module 3 part, and that we also look forward to your plans and peer review exercises as a means to share ideas and to continue building on this initiative within FIP on digital health in pharmacy education. And thank you again, and I would like now to pass on the floor back again to Professor Arakawa.
Thank you, Lillian. So these are the introduction of the modules and the program. So probably you are wondering how you're going to register and how you're going to start this endeavor to integrate the digital health in your pharmacy curriculum. So just in case no wondering, please just note these 2 email addresses. For queries about the course program, you can contact me at education@fip.org, but also for queries about the online platform that you're going to work this program on, the FIPX platform, and the technical support while you're doing the program, there's the contact email fipx@fip.org. But for those of you who are wondering how to register yourself and how to start the program, now the FIP team is going to present to you how to register. So now I would like to hand over the floor to the FIP team to introduce the FIP Provision and Partnership program, as well as how you will register yourself to this special Train the Trainer program on digital health in pharmacy education. Here, I'd like to introduce Dr. Daria Bazis, FIP lead for Provision and Partnerships. Daria will introduce our special young pharmacist group interns who worked very hard for this project as well. But before that, personally, I would like to say a big thank you to Daria and also these special interns, Genuine and Chichin, for their such a hard work for the program and the development. Thank you so much. So now floor is yours, Daria.
Thank you so much, Narko. I just want to make sure that you can hear me okay. Thank you so much. I think a big thank you and gratitude goes out to all of you, Narko, Aki, and the team behind this humongous piece of work, Train the Trainer in Digital Health in Pharmacy Education. I am delighted to be joining you here, and I've had the honor in supporting the development of this program. But I would like to maybe just give our listeners in today and the attendees a bit of an overview on the Provision and Partnerships program that has supported the development of this program. A bit of an overview in case you are new to FIP. FIP is renowned for providing networks and platforms for collaboration, support, and friendships over decades. And normally, this is done face-to-face, and we do that with pleasure, and we know that this adds value to our professional and personal lives. But during the pandemic, the focus of FIP changed, and to deliver and engage with all of our colleagues and members via digital means. And so I'd like to say that digital provision is here to augment face-to-face opportunities. It is here to stay while we are experiencing travel bans and travel restrictions, but also digital provision is here to stay, and as strongly as digital health is here to stay. Hence, the inaugural course on digital health that FIP has embarked upon. During the last face-to-face FIP World Congress in 2019 in Abu Dhabi, that was the last time we met face-to-face with colleagues, to provide a platform to member organizations and partners for provision was identified and agreed on by the FIP Council as a priority and as a direct member benefit. That is to work on FIP as the FIP global platform to identify regional and member needs and to develop programs and opportunities for development of the workforce aligned with the FIP development goals. If you don't know about the FIP development goals, we will insert a link for you to find out more about them. So, since 2019, we have been delivering on this commitment from concept to implementation, to mobilize the FIP global platform for provision and partnerships. So colleagues, this is about FIP acting as a conduit between our members to support the development of the workforce in any sector across science, practice, education, and workforce on a nation, local, and regional level based on their national and regional needs. It's about provision, twinning between member organizations with priorities for workforce development in particular areas and with member organizations with quality provision, i.e. programs and courses. And so I just wanted to highlight some of the key features that are listed on this slide of this program. And the program is multifaceted. By that, we mean it's encompassing, varying across science, practice, education, as I already mentioned. So providing a very diverse platform. We work in collaboration. It's a collaborative endeavor where our approach is to collaborate with our members and our partners across all areas of practice and science education. But also we are consistent in our approach. Our approach is entrenched in a needs-based approach. The ideology of FIP's needs-based approach is where you're basing your education, your workforce development on the needs and priorities of nations. And the same thing applies for education and also continuing professional development. This platform is also responsive. It's responsive to those needs. It is not in competition with our members or partners, and also transparent in our approach and the processes that we have put in place to mobilize the platform. True and real and transparent partnerships with our members and partners. Next slide, please, Narko. In the interest of time, I will only highlight to you how we work or mobilize the platform. The program has a wide and dynamic scope, and it encompasses several models by which FIP can work with members and partners. And so I would just mention in listing the different models and how we can facilitate these partnerships with providers. The first one that appears on your slide is working with providers of continuing professional development through the FIP seal. That is an FIP seal that is a signal of quality, that is FIP special, that particular quality providers can apply for. If you click a couple more times, Narco, to save you the hassle, we can also support, we can also co-create, and we can work together with providers, but also we can work across the FIP constituencies internally via the fourth model, where FIP provides direct provision. And if you click one more time, highlighted in blue is exactly what we have done with our colleagues here today from the academic pharmacy section, from the technology forum with YPG to provide direct provision from within FIP. One more click, please, Narco. In doing so, we followed the needs-based approach that I mentioned earlier. And this is about provision that's based on member needs and priorities. My colleague Nilhan provided you with an overview and archaea of the results from the 2021 report. We built on those results, on these findings. So it is a needs-based approach. We also made sure that it is aligned with the FIP development goals. In this case, FIP development goal number 20 on digital health. We've collaborated across the FIP constituencies, as I described earlier. And we've also made sure that the course is in a format that could really instill change makers within our communities in pharmacy. So it is a train the trainer in format to be able to mobilize change makers within your sectors of practice. It is delivered via the FIP Moodle, FIP-X, we refer to it. It's the online learning system at FIP where the course is housed, and our FIP members can avail of this platform as a member benefit. Finally, this course is quality assured and will be quality reviewed as we progress in its implementation with data and evidence of impact that we could present back to our members and our colleagues around the world. So with that, it gives me really great pleasure to thank our FIP officers and volunteers for developing this course under the leadership of Narco and Archaea from the academic pharmacy section. We are really thankful for all your efforts and the time that you have spent developing this course. Special thanks go to our CEO, Dr. Catherine Duggan, for her support in this endeavour. I'd like to now also say a big thank you in advance to two young pharmacist volunteers who have joined me in this journey for the past 3 months. It's my great pleasure to introduce Genuine Desaya and Chu Chen Cheng, who will shortly introduce themselves. But Genuine is a clinical pharmacist who currently lives and works in Kenya. He has a keen interest in global health, policy making, and pharmaceutical supply chain management. He currently serves FIP as a Provision and Partnerships Young Pharmacist Remote Volunteer. Chu Chen is a hospital pharmacist who currently lives and works in Taiwan. She cares about global health issues and curious about extending and expanding her role in pharmacy. Hence, she decided to also serve the Federation in the Provision and Partnerships program as a young pharmacist remote volunteer. It's my great pleasure to turn the microphone to Genuine and Chu Chen. The floor is yours.
Dear colleagues, thank you all for participating in this meaningful event. I'm Chu Chen Cheng, a Taiwanese pharmacist working in the hospital and one of the FIP-YPG remote volunteer. I helped to explore and build the user guide of the online learning system, which is our FIP-X, and also we had the first course on it, the Train the Trainer online course. Our team worked tightly to develop a brand new independent website, explored every single detail of it, and spared no effort to provide the best user experience for our course creators, teachers, and people who aims to gain the vital knowledge in the digital era. In the COVID-19 era, working and learning in a digital way is inevitable, and our course will strongly support us to reach the goal. I joined FIP to explore the possibilities of being a pharmacist, and my colleagues had inspired me by terrific self-learning skills, organization capabilities, and problem-solving faculties. I totally believe that immersing oneself in any process of proceeding with the mission of digital event and working online will simultaneously obtain the skills required in the digital era. So do the future participants and you today participants here, as you kindly spend your precious time here and are willing to join the upcoming Train the Trainer online course. Thanks to the support of my dear colleagues, Dr. Catherine Duggan, the Chief Executive Officer of FIP, Dr. Dalia Badges, Lead of Provision and Partnerships, Dr. Janine Desira, my FIP remote volunteer coworker. We can't achieve the goal without these amazing colleagues, and hope everyone would gain benefit from our Train the Trainer course on feedbacks, and feel free to feedback to make our course and feedbacks even better. And welcome join FIP and be the change you want to see in the world. Thank you.
Thank you, Chu. Greetings, colleagues. We are glad that you're here. My name is Janine Desire, a clinical pharmacist from Kenya and a YPG intern. I was involved in the creation of the FIPEX user guide and polishing parts of the FIPEX online learning system. To echo my colleague, I am delighted to be part of this team and to have worked under the excellent leadership of Dr. Dalia Badges. Colleagues, what we are sharing with you today is special because it is based on your needs and priorities to learn more about digital health in pharmacy education. We are glad that all of you are here, and we know you're excited to join us. We are definitely looking forward to having all of you in the course, and we certainly hope that you'll benefit greatly from it. The online course was created in the FIP model, which we call FIPEX. FIPEX is FIP's online learning and professional development system, and it is a separate platform from the FIPEX website that is designed for course developers and participants. Next slide, please. So what do you do to register for the course? To join the course, you will need to register your interest to be enrolled via the link we will share in the next slide. Once registered, you will receive a confirmation email from FIPEX, and your login details will be sent to you in 3 to 4 working days. You will be prompted to change your password when you log in for the first time. Kindly ensure that you do this. Next slide. As stated earlier, if you're a member of FIP, you can register for the course at the link that has been displayed. You can also scan the QR code displayed to go to the registration page. The link will be available in the chat box, and it will also be displayed at the end of this launch event. The link is embedded in all our promotional material, so if you don't capture it right now, don't worry. This link will take you to a registration page where you will be required to fill out some information. Please note that the course is a member benefit and it will only be available for FIP members. Next slide, please. Therefore, those who are not yet FIP members would like to encourage you to join our great federation to avail the many benefits and resources that FIP offers, which include an opportunity to enroll in this course. The registration link for memberships is in the chat box. Thank you and take care. We'd like to hand back to the moderator of the session, Barry, to start the Q&A session. Thank you.
The host has stopped my video. There I am. If I could get all the panelists to come on camera, everyone. We're going to begin a little bit of our panel discussion to answer some questions. There we go. I see one of our questions was looking at the duration of the course and the course fee. I know Dalia was answering that question in the Q&A. And
Thanks,
somebody
Barry.
go ahead.
Thanks, Barry. I was just going to suggest that Nako and I can describe the duration of the course, but the course is planned so that each module is carried or can be completed within 3 to 4 hours per module. That's if you're consistent and actually starting the module and just finishing it up on average. But of course, the course is going to be open for at least 9 months for people to complete. It won't take that long for sure, but that is just to give people the flexibility of being able to go into the modules, to try them out, try the different activities, do the required reading. So it's a really beneficial experience for everyone to make the most out of it. I'm not sure if Akia or Niko would like to add anything else about the actual structure and timing. Thank you.
Well, maybe just a short follow-up from my side. So I think the estimated number of hours is, as you mentioned, Dalia, but maybe also good to mention that we also provide more background materials. And for example, with the module 2, we expect participants to have a look at 2 videos, but there are 6 videos. So of course, participants are welcome to do more, but to complete it within the time, there's a kind of core that should be completed, and there's of course then voluntary additions to all of the modules.
Thank you very much. I do want to direct everybody's attention to the chat room. There's a lot of great links in there for you to see, to click on, to give you more information about from joining FIP to registering for the course, to the digital report that we have. So there's a lot of good things. Dahlia's been very good in getting everything about what's going on with throughout this program, and so have others. So please do that. There was a good question from Miranda about what is the plan for updating these materials?
We do have a plan. And the plan was going to be that after the first cohort of registrants complete successfully the course, we plan to review the course towards the end of 2022 for another launch, hopefully in 2023, with amendments and adjustments based on participants' feedback and also the instructors' experience with it all. This is the plan so far. I'm not sure if anybody else would like to make any comments.
I know there'll be opportunities for, if there's some significant change, especially in terms of technology or in terms of some of the things we want to be teaching, we will probably have the opportunity to add to that too. So, but there is a scheduled plan for updating. Does the digital, do we cover strategies to educate not only pharmacists, but also patients? Jaime?
That's a very, very interesting question. I would say that the course, and correct me please, Naoko and Naoko especially, this directed the module 1 especially to pharmacists, because FIP is a pharmacy-oriented organization, of course. But I saw the question and I found it very interesting. First, this course is built on the digital health report that was highlighted a few times during this presentation, which I think is a foundational report in terms of digital health. It's letting many pharmacy organizations and individual pharmacists be aware of the promise of digital health. But as practitioners, we are very much involved and engaged with patients. So in the same sense that we are going to educate pharmacists, we will educate patients through pharmacists. That's what I think about the question.
Okay, thank you. I will also say there is part of module 3 where we are talking to the concept of it is our job to help remember the human. We're dealing with people, not just technology. So I believe that we're not training patients, but we're going to help you understand your patient's fears and working with digital health, just like we have to with healthcare and medicines in general. Our FIP members, non-members eligible for this course, and I believe it was stated for FIP members only. If I could answer that question. And I don't see any other things in the chat or in the question room. I want to thank the panelists very much for being here to answer questions. I just think that, oh yes, Daya.
Thanks, Barry. I've just another question just popped up about when does the course actually start. So you're invited to register to the course immediately if you're an FIP member, and we will start enrollments next week. You will be notified via email of your login details to the course. And so registration is immediate for any FIP member. And if you're not an FIP member, we would really encourage you to explore FIP membership for individuals. I've added the link to the chat box, and also explore our website for varied member benefits for individuals from all around the world, really. So we invite you to consider FIP membership. We would welcome you to do that.
Thank you.
Yes, you're very welcome.
I wanted everybody to look, if you had the chance to look in the chat room, you had greetings from all around the world today. And it's a very moving event when we get this many pharmacists from this great of a location to join us in this important launch. And it's a very concerted effort by very many sections of FIP. Can I have the next slide, please? Or the last slide, should I say? Because that's my final wrap up. Please note that we have many other events, and you can go to events.fip.org and look at what else we have going on. And please know that we have our annual meeting still in the planning stages for September in Sevilla, and I think that's a good time. I hope we all can meet in person. It's been a while since Abu Dhabi, but we will meet again, even if it's digitally. I saw one more question pop up. Are IPSF members eligible to get into the program? I'm not sure about that. But if that's part of FIP, somebody will answer that question in the thing. I'd like to thank all of our panelists. I'd like to thank all of the presenters. I'd like to thank everybody who's been involved in creating this digital event. And most importantly, I'd like to thank the people who have attended. I hope that we gave you a lot of good information to see what we're all about. I mean, everything from learning from the basics to even doing some experiential. It's for us as pharmacists to experience and to learn about digital health. And remember, this is the train the trainers. So that's why it's a little more advanced than just train the pharmacist. We're working on that. So thank you very much. And let's wrap it up. I'll send it back to Naoko.
Okay, thank you everybody for coming to the launch event, and then also the I would like to also give the big applause to all the volunteers who work on this development of the program. I hope everybody enjoy this program to become a change maker. Thank you very much, and they hope you have a lovely day. Bye.
Bye.
Bye, everybody. Thank you.
Thank you very much. Take care, everyone.